News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you'd like to learn about the 12 steps and about the 12-step program of recovery, you'll want to watch our show today. We have a great guest. His name is Father Bill Wigmore. Father Wigmore is the president and chief executive officer of Austin Recovery. Bill has been a counselor and an administrator in the field of addictions recovery for over 35 years, and he's helped thousands and thousands of people, individuals and families, find recovery. Bill is a friend and colleague and mentor of mine back from the mid-'70s in Detroit, Michigan. And Bill, it's great to have you here as our guest today. Thank you for coming.
Oh, it's my pleasure to be with you, Tom.
Great. So, Bill, at Austin Recovery, I love hearing about your program, the way that you've integrated therapy and the 12 steps. Could you tell us how you do that at Austin Recovery?
Well, we try to do it differently maybe than other programs around the country. I'm a big believer in experiential therapies, that one doesn't just cognitively learn something, but that you have an experience of it. Mm-hmm. And so many of the therapies that we're doing we're very spiritually based, as is most of the 12-step recovery, certainly in the history of the movement, is to bring about that spiritual awakening. Mm-hmm. Step 12 talks about that, having had that as a result of the steps. My measurement for success is, are people coming through the program and reporting a spiritual awakening, an opening to a different level of life.
Mm-hmm. And so you're hoping then, through your integration of these experiential therapy techniques and the 12 steps, that someone will see life differently and behave differently in their whole life. They'll stay clean and sober, of course, and their whole life will have changed, or it'll begin to change there, Bill?
Yeah, I think if we don't offer people something better, you and I go way back. One of the things I was told was, if I didn't find, I'm a recovering alcoholic myself, if I didn't find something that felt better than alcohol or drugs, I would return to it. And I went through treatment a couple of times, and I did return to it because I didn't find anything better. And I think that's a necessary ingredient for recovery. It's not just information about an illness. It's about finding a way of life that feels better than what the alcohol and drugs were doing for us.
Yeah, and so that is, of course, what you're doing. And as we look back to the roots of the 12-step recovery movement, can you tell us a little bit about the origins of how these 12 steps got going here in the United States, Bill?
Well, I've done a fair amount of research on that. It actually stemmed from a program called the Oxford Group, which was Frank Bookman was a Lutheran minister who had a personal experience, which in his experience, it really laid out what then Bill Wilson later came and tried to codify into the 12 steps of Alcoholics Anonymous. But he said himself, steps 1 and 12 came from AA, but 2 through 11, he really owed them to Sam Shoemaker, an Episcopal priest, and to the things that he learned from the Oxford Group in the 1930s.
And so the Oxford Group that influenced Alcoholics Anonymous then, and AA has influenced all these other 12-step programs. It was originally really about changing your life, huh, Bill?
It was about changing your life, and what Bookman was interested in doing was then changing the world. And what AA was interested in doing was not changing the world, just changing alcoholics. So that, they parted company. Bill Wilson got sober through the Oxford Group. Dr. Bob, the co-founder of AA, was also a member of the Oxford Group. They did that for about 3 or 4 years. They got sober in 35, and then it was 38, 39 when they split. And someone went to Frank Bookman and said, "Frank, the alcoholics are leaving." And Frank's response was, "I have a drunken world to worry about."
The whole world, huh?
So it kind of says it. You can see where his mind was on.
Yeah.
Yeah.
So, Bill, we've got about 30 seconds left in this segment. Could you tell us, just wrap it up a little bit more, just about this experiential change that you hope to encourage and engender in people at Austin Recovery?
Well, we do therapies that are going to evoke the spirit in somebody. Austin has a label, keep Austin weird, and we're kind of doing our part to do that. We're doing sweat lodges with people. We're doing musical journeys with people. We're doing inner child work, scripting with individuals. We're teaching them to go inside. And I think inside is where you find and begin the change.
So that's really good to hear from Bill about this change at depth. And after this brief break, we're going to go ahead and explore that further about the 12 steps and how that's integrated at Austin Recovery. We'll see after this brief break. Hello, and welcome back to New Skills for Living. We're talking with Father Bill Wigmore about the 12 steps of recovery. And in this segment, we're going to talk about the steps of recovery, and in the next segment, we're going to talk about the fellowship. But Bill, quite frequently, those first 3 steps are referred to as the foundation steps. Can you talk with us a little bit about those, please?
Yeah. The first step in the program is where one admits one's powerlessness over alcohol, drugs, in our case, and that our lives have become unmanageable, meaning that I can't change this thing by myself. I try to quit repeatedly, and failure is a result. Maybe I stay sober a week, a month, 3 months, but invariably I go back to it. And then what happens is in step 2, I begin the connection process, to connect to a power greater than self. And this is somewhat vague in the 12-step program, but it's God as we understand God, or even better from the history, God as you don't understand God, because the truth is nobody does. St. Augustine said that pretty well, and I think he had it right. Anyone who thinks they understand God should call for help. We don't. And then to begin a surrender process to that God, to begin an act whereby you say, I can't manage my life. I've tried, and the results were repeatedly failures. So I'm going to give this thing a shot, and I'm going to put myself in a position where God can begin to direct me. And so that's the basis of it. And it's really a decision. It's a use of the will. It's not a white light experience. Rarely does that happen. But an understanding that I can't stay sober, or I can't stop eating compulsively, or whatever the behavior might be, or I can't stop hating. It's not just limited to. I mean, we get addicted to all sorts of things.
And then, so moving then from that foundation, frequently those next 6 steps, 4 through 9, are called the housekeeping steps.
Yeah, I refer to them as correction.
Correction, okay.
Making a change in me. See, I was always wonderful at taking everybody's inventory. I thought it was a great gift that God had given me. I could tell you what's wrong with you, with you. I mean, I was very...
Good insight at the time.
Oh, yes. I stunk at saying, what's wrong with me? What's my part in this? And that's really historically where the steps began to develop, where the inventory process came in. So what's my part in it? I'm pointing to you, there's 3 fingers coming back at me. So to look at my part, to be willing to change. Frank Bookman, for example, did a lot of work. His started with a resentment. He had a resentment towards his board of directors, where they had done something wrong to him, and as he hated them, he felt God's presence missing from his life. He made that wonderful connection there. And he was able to do that then with other people, with the French and the Germans after World War II, and to have each take responsibility for their part in it. I mean, that was his gift.
So I guess, Bill, part of that is taking an inventory, and then there's a confession of sorts to another.
To one another, and it usually
where you kind of sit down and you admit to someone face to face, like.
Yeah, and interestingly, it's not just a confession. It's often having the confessor confess first.
Uh-huh.
Having the confessor say, you know, Tom, let me tell you about me.
Uh-huh.
And as I tell you about me, as I share what anger did to me, what alcohol did to me, what drugs did to me, what infidelity did to me, as I share this with you, as you begin to see a level of honesty in me, it calls that forth from you. And that's really the beginning of the change.
So that's an important part of the housekeeping is
Yes.
the self-honesty and the ability to listen and share with another person.
And then to make amends for the wrongs that I've done.
So we've got just about 15 seconds here.
Okay.
Can you very quickly tell us about amends?
Yeah, that if I've done wrong to somebody, that I need to go to you and to own my part in that. And not only to clean my side of the street, but, and I'm kind of an historian with this part, but also to evoke once again from you that change in yourself.
Yeah. Well, that's excellent learning about those housekeeping steps, and we're going to continue to explore the program and the fellowship right after this brief break. Oh, and welcome back to New Skills for Living. We're talking with Father Bill Wigmore. So, Bill, would you share with us your perspective on those steps that are sometimes called the daily living steps, 10, 11, and 12?
Right. Yeah, the program sort of finishes with 1 through 9. And then 10, 11, 12, maintenance steps, some people call them. I call them the connection steps. As I've done my research on the history of Alcoholics Anonymous and the Oxford Group connection, more and more I came away convinced that that prayer and meditation piece is really at the heart of the transformation process. Even in some AA literature, some early AA literature, it spoke about, it was that morning quiet time that made the changes in people, not the attendance at meetings. They said meetings were helpful, but the quiet time was absolutely necessary to bring about the change. Well, that's almost heresy.
Yeah,
in most 12-step programs,
you
it's
don't
90
hear
meetings in 90 days.
Yeah.
There's a do-it-by-rote kind of thing to it, which I'm kind of against. I mean, meetings are good. We encourage our patients to go to meetings. But meetings alone will not do it. What does it is that connection. And that connection is where the transformation happens. That the ego, alcoholics by and large are very ego-centered. And there's a need for humility. And the only way I think that you're going to bring that about is by kind of showing up every day with the failures of the day. And I fail every day, to live the life God is asking me to live. And but He doesn't yell at me like my father did. Very, very loving, very accepting, very warm. And now we're going to do this tomorrow. And I'm going to learn from the mistakes. And I'm going to go to you with my 10th step, and I'm going to say, Tom, I hurt you yesterday, and I apologize for that. And to try to keep it clean. And then out of that comes 12, which is a spiritual awakening, which is the thing we spoke about earlier, that you find a better way to live, a more loving way to live. Some people define addiction as a love disorder, and I'm with them, that they're really onto something there. I never let people love me. And I was very guarded, and I still am. This is. I mean, it's not my nature to be in recovery. My nature is kind of goes against that, and so to allow people to love me, to begin my reaching out to love them. This is what recovery's about. It's what life's about, And we're doing a lousy job of this in the world. So I think Frank Bookman was really onto something. That if we don't really begin to find this change in ourselves and then bring it to the world, we're going to be in for some very rough times.
Well, Bill, could you tell us a little bit more about this combination of journaling and quiet time, of meditation and journaling? I'd really like to hear more from you about that.
Okay, if you promise not to have me committed as a result of this, because I was kind of really shocked when I reached into the history. And what I found them doing is they would read some spiritual literature, if they were Christians, and there were some specific things. They would read the Sermon on the Mount, 1 Corinthians 13, the love chapter, and the letter of James. If they were Buddhists, because Bookman worked with them as well, read the literature there. And then they would do this. Quiet time began actually when they would then pick up the pencil or pen and begin to write the thoughts that came into their mind. And sometimes they would ask a question, and they would receive guidance. Perhaps it's an amend that I need to make. Perhaps it's where I'm failing in loving my family, in being honest at work. They had 4 absolutes that they talked about: honesty, purity, unselfishness, and love. And in some areas of AA, particularly around the Akron and Cleveland area, they still focus very, very much on those. It's a wonderful way to live. Well, lead me on to the next question.
So of course, the other part of that too in the 12th step is about getting outside of oneself and helping other people that have problems with alcohol and drugs, or living a more self-transcendent life, huh, Bill? The thing that we do a very bad job of in our culture is teaching people how to live. And so what often happens in recovery, someone comes into a crisis and they're 28, 38 years old when they really begin the process. And in many cases, Tom, it's a fathering process or it's a mothering process that really happens. They're recovering from alcohol or drug abuse, and emotionally inside we're 6, 7, 12 years old, whatever it may be. And we then come into contact with someone who's going to say, let me teach you how to live, son. You know, let me teach you how to deal with your feelings. Well, Bill, let me bridge from that. We need to take a break, but we want to come back to that right after this brief break. We'll see you in a couple minutes. Well, and welcome back to New Skills for Living. We're talking with Father Bill Wigmore. So, Bill, you were talking about in our society, you have this sense that we're just not doing a very good job of fathering and nurturing. Can you tell us more about that? Yeah. I don't think we're teaching, particularly our young boys, how to become men. And so we stay stuck. In some more primitive cultures, they have traditions, ceremonies, where in the primitive, for example, the men from the tribe, the elders from the tribe will come in, and in a stage setting, they will rip the young boy, 12, 13, 14, out of his mother's arms and take him into the woods. It's a wonderful time. It's when alcoholism and drug addiction often start with the young people that I work with. 12 or 13 years old. Right. When did it start? And they take them into the woods and they teach them the ways of the tribe. And we don't do that. We don't do them. We leave them stuck. And well, so often, Bill, the rite of passage in our society is be 12 or 13 and go out and start getting loaded. Get a fake ID and get loaded, right? Yes. And you know what they will do in the woods is they will scar them in some way. There'll be circumcision. There will be tattoos that are going. Where's that happening now? It's happening on the streets. It's happening in the gangs. Young kids are joining gangs to get what we're not giving them as fathers. Whether it's a street gang or a suburban gang, it's some kind of peer group gang rather than someone older teaching someone to be a man. Right. Right. And so is that one of the things that you do at Austin Recovery, is you kind of reparenting? Yes. Can you tell us about? And this is where some of the experiential therapies that we're doing are so helpful, so that people are getting a feel for this. So we do drumming circles. And people start to feel the something alive inside of them that they could only feel when they were getting stoned. And now they're able to feel this and be okay with it and recognize it. And to do other ceremonies. We've done some sweat lodges with them. We do musical journey where it actually puts you into a mild trance and you relive some traumatic experiences and such. Those rites of passage are tremendously important. And of course, one of the things that I would surmise happens with a healthy rite of passage is a young man has possession of himself, and it's more of an internal locus of control. And not looking out to people, places, and things, or booze or drugs to feel better or feel okay about themselves or feel
Right.
comfortable in their own skin.
Right.
We've got a little more time in this segment, Bill.
Yeah.
Tell us about
and,
that.
and ready to leave childhood behind. You know, Paul said, when I was a child, I thought like a child, I acted like a child. When I became a man, I let go of it. Well, this is how do you teach somebody to become a man, or how to become a woman, because that's what recovery is going to be. Stop thinking about yourself. Can you go and help somebody else? You know, are you giving rather than taking? And we just do a very, very poor job of that in our culture.
So along with mentoring, which in the program maybe historically has been called sponsorship,
Yes.
we've got about a minute here, Bill. Could you tell us a little bit, you know, there's that saying that you alone can do it, but you don't have to do it alone, which is about the program or the fellowship of recovery. Can you tell us a little bit in about a minute about that?
Yeah, that we need connection. And it's not just connection with God, though that is important, but it's also connection with one another. That I see other people, meet other people who get to know me and get to love me and get to trust me. And I then pass that on to others. I mean, that is why the fellowship is so extremely important.
In fact, for some people who grew up maybe in an alcoholic or addictive family, the fellowship in some ways becomes a family in terms of support and nurturing and encouragement and guidance. Huh?
Right, it absolutely can.
Yeah.
Absolutely can.
Well, Bill, it's been great to have you here to do this show with us on the 12 steps. Of course, we're going to do another one next month, taking more a look at the spiritual aspect of recovery. We want to thank you for joining us here. It's been great to have Father Bill Wigmore talking with us. Up on your screen, I hope that you'll see that they're putting up the website. And so this interview with Father Wigmore, as well as all my other guests for the last few years, are on the website. We'll see you next month again when we talk with Father Wigmore about spirituality and recovery. Take good care of yourself.